Hi, it's Dr. Quinn Throckmorton, and if you are watching this video, it means that we have discussed fixing a fracture in the office. Because very few people can remember things very well in such an environment like a doctor's office, I thought it was best that we get together online here and review what you might expect. I know we talked about this some in the office, but I'm just going to go back through some of those high points that I mentioned so that you can have a clearer understanding of what's all involved with surgery and what you can expect. So with most fracture surgeries, there are pluses and minuses. And on the plus side, fracture surgeries overall are pretty successful. Somewhere around 80 to 90% of the time, patients are happy that they had it done and they're better off than they would have been if they hadn't had the surgery. Thankfully, a lot of fracture surgeries can be done outpatient and you can go home the same day. Sometimes with more severe fractures, we need to keep you one night in the hospital, and that will really depend on the type of fracture and what the anesthesia evaluation looks like. At the end of the rehab, your function is going to be variable. There are some fractures that are more prone to stiffness, and if that's the case, then you and I will have talked about that in the office. There are other fractures, such as clavicle fractures, where if we put a plate and screws on that, then patients can look forward to having pretty near normal function as long as things go well. So we will have discussed the ins and outs of that in the office. On the downside, fracture surgeries do take some time to heal. As a rule of thumb, fractures take about 6 weeks to heal together. So for the first 6 weeks after surgery, you'll be in a sling most of the time. And for the first 2 weeks, you and I will talk about some gentle exercises that you just do on your own at home to gently mobilize the joint before you come back for your first postoperative appointment. The second 6 weeks, you're usually out of the sling. As long as the bone is healed, you can start using the arm gently for activities in front of the body. Things like driving and taking care of yourself and playing with your phone, all that stuff is fine. As far as the follow-up appointments go, you see my PA at 2 weeks and 6 weeks, and he will run you through the rehab program. You see me at 3 months after surgery, and that's where we talk about whether things are okay and whether or not we can let you go to use the arm however you like. As far as our physical therapy programs, most of them are done by protocol. So when you come back at 2 weeks, you'll get a prescription to go to a physical therapy place of choice. Wherever is close to home or convenient for you is fine. And as long as the therapists adhere to that protocol, that's all that we ask. Then again, you see my PA at 6 weeks and then me at 3 months. The risks talk is pretty important here. Everybody wants their surgery to go well, and we certainly want that for you, but unfortunately there are things that can go wrong. Things like bleeding, like blood transfusions, are pretty uncommon after fracture surgery. Infections generally around 1%. Damage to the nerves and blood vessels or muscles or tendons, it's very unusual. Less than 1% of the time will you have a permanent injury that won't recover from that. Sometimes bones won't heal despite our best efforts, and when that happens, plates can bend and break. Overall, that's less than 5% of the time for most fracture surgeries, but it's certainly a risk. And if that happens, then it may come to more surgery down the road in order to try to deal with that problem. Same issue with stiffness. Sometimes folks will develop a stiff joint after a fracture surgery, and sometimes that will come to more surgery down the road as well. If we tell you that there's an 80 or 90% chance that you'll be happy after the surgery, that's a nice way of saying there's a 10 or 20% chance that you won't be, and that can be for whatever reason sometimes, and that can be unfortunate if it does happen. The last thing to think about is the anesthesia risks, which is really based upon your medical well-being and how ready you are physically to have surgery. Everybody is worried about pain after surgery, and so are we. We have a very well-studied pain program here. We've been studying it for the last 10 years. It involves several aspects of pain management. We typically do an injection during surgery, which is pretty good for relieving pain for about 3 or 4 days afterwards. And then we use what's called multimodal pain management, where we use several medications, typically about 4 of them, to hit the pain at different points in the cycle to minimize your pain. When we've studied our pain program overall, the pain that people have the day after surgery, meaning the worst part of their pain, is about 3 out of 10. The last thing to know is that you'll have my card. It has my number on there. It's a direct line to my assistant, so if you have any problems postoperatively, you can always give me a call.